Hi, I'm Dr. Christina Wu. I'm a GI medical oncologist. I'm also an associate professor in hematology and medical oncology at Emory University Winship Cancer Institute. So the question is about side effects from cetuximab and whether having side effects being the drug is working better. So to start off with, cetuximab and panitumumab are both antibodies that target a protein called EGFR, or epidermal growth factor receptor. In order for our patients to be eligible and a good candidate for this antibody, we have to make sure that we check for whether they have KRAS, KRAS, or NRAS mutations. Because if their tumor has that mutation, they are not going to benefit from it. So another way to look at it is they have to have KRAS, NRAS wild type tumors, meaning they do not have that mutation. Now, the way the antibody is delivered is by intravenously, often in combination with other chemotherapy agents. The side effects from this antibody therapy are unique in that they can cause what we say is an acneiform rash. The way I usually describe it is you may have to relive your teenage years where you will have acne, usually on your face, on your chest, and your back, and people develop different levels of rash. We sort of approach this in a proactive way to try to prevent you having some side effects. And so we usually prescribe moisturizer for your skin. Not prescribe, but we ask that you use moisturizer for your skin, face, and body. Sunblock, because sun can make the skin side effects worse. We also prescribe hydrocortisone cream, 1%, to the areas that may be affected. And finally, start our patients on either minocycline or doxycycline antibiotic. And these are pills that we prescribe to teenage kids for acne. So the combination of these four things are what we start with before people start their treatment in the hopes of getting good control of any of the side effects that might happen. Now, sometimes, despite that, people do have acne, and it can be pretty bad. It can be red, it can be painful, it can be pustular. In those cases, we can change to a stronger prescription strength steroid cream. And we can also use Cleocin, which is a type of antibiotic gel for the face, in addition to all the other things I talked about. In the more serious cases, we may have to start steroid pills called dexamethasone to help subside the skin rash. And then we have to have a conversation about, how we can make sure that this is better tolerated. The question about whether a skin rash means that the drug is actually working, I mean, there is some thought that there are some studies that having a skin rash may be more indicative of this drug working, but having a severe reaction versus a mild reaction is not necessarily indicative of this working better. And I've definitely had patients who've had very mild reactions or none and still benefit from it. But yes, there is some literature saying having a skin rash may be indicative of this drug working better.